Hi, I am Dr. Saqib Mansoor, and this is my channel Learning Anatomy for You. And today I will discuss with you the anatomy of the hip joint. Here you could see this is the formation of the hip joint, which is also called as the acetabulo-femoral joint. This is between the acetabulum of the hip bone and head of the femur. This is the femur, its head, and this is the hip bone, and this is the acetabulum. We'll discuss in detail, and I will highlight hip joints, articular surfaces, the synovial membrane, and then its movements, and blood supply and the nerve supply. So this is similarly another picture for the hip joint. Here you could see this is the hip joint. Yeah, right. So hip joint is an articulation which is the ball and socket type. So this is a connection between lower limb and the pelvic girdle, right? This is the lower limb and this is the pelvic girdle. This is a connection between these two, the hip joint. It's a very strong and stable joint. Its stability is important, and it is the most stable and strong joint in the body. Largest joint in the body as well. Its type is the multi-axial ball and socket synovial joint, right? So I will show you what is the ball. This is the ball. Head of the femur is the ball, right? This is head of the femur, and this is the ball. Head of the femur is the ball in the joint. This is the head of the femur, is the ball. And the socket, acetabulum is the socket. You see here, this acetabulum, this is a socket. Follow the laser, and this is a cup-shaped acetabulum. This is a socket of the hip joint, and the joint is designed for stability over a wide range of movement. The hip joint is the most movable of all joints next to the shoulder joint, right? And we know the shoulder joint is the most movable joint in the body, and after that, this is a hip joint. And in the shoulder joint, the mobility is at the cost of the stability, and the stability is lost relatively in the shoulder joint, but it maintains the both of these. This is the specific to this. So while standing, the whole weight of the upper body is transmitted via hip bones to the heads and necks of the femora. So articular surfaces, femoral head, 2/3 of a sphere, right? This femoral head, this is the 2/3 of a sphere, right? And acetabulum is deepened by the fibrocartilaginous labrum acetabulary, right? And I can enlarge for you, zoom in, right, to show you this acetabular labrum. And here you could see this is labeled for you. This, and this. You can see the labeling. This is the acetabular labrum. This deepens the acetabulum. This is the acetabulum, and it is deepened by the acetabular labrum for fibrocartilaginous rim. Non-articular acetabular notch is closed by the transverse acetabular ligament. Here you could see this, and I have to enlarge this as well. This is, the in this picture, yes, this is the acetabular notch formed here, and this is bridged by the transverse acetabular ligament. You could see this, right? And ligamentum teres, ligament of the head of the femur, passes from this notch to the fovea of the femoral head. And again, I zoom in for you. Here you could see, in this zooming in. Yes, here. This is the, fovea of the femur of the head. And this is ligamentum teres, and this cut over here. And this is attached in that fovea of the head of the femur, extending from this ligamentum teres, extending from this transverse acetabular ligament to this fovea of the head of the femur. Here you could see this. All of the head of the femur is covered with articular cartilage, except for the fovea, for the ligament of the femoral head. This is the articular cartilage in the head of the femur. Acetabulum, right? So this is the acetabulum. You could see the laser. This is the acetabulum. Is all. It's a hemispherical hollow on the lateral aspect of hip bone and is constituted by the fusion of the three bony parts. You could see what are the three bony parts. This is the ilium, and this is the pubis, and this portion is the ischium, right? These three bony parts, they together contribute in some part of the, each of them, some part of the acetabulum, right? Here, this is the heavy prominent acetabular rim, right? This rim, this is the rim, acetabular rim or acetabular margin. I will enlarge very soon this picture. The acetabulum consists of a semilunar articular part that is covered with articular cartilage, the lunate surface of the acetabulum. So let's now zoom in. This is the point. And right, this is the acetabulum. It has a lunate surface. Here you could see this. This articular surface is the lunate surface. And then is the margin of the acetabulum. All right, you could see this. This is the margin, also called as limbus, margin. This is also called rim of the acetabulum. And you could see this is the acetabular notch. I showed you already that this is bridged by the transverse acetabular ligament, acetabular notch. And the acetabular rim and the lunate surface form about 3/4 of a circle. Missing inferior segment of the circle is called acetabular notch. I showed you already this. So few words about the acetabular labrum. It is lip-shaped. Latin means labrum, and Latin word labrum means lip. Fibrocartilaginous rim attached to margin of the acetabulum that increases acetabular articular area by about 10%. So let's zoom in again. So here you could see this is the acetabular labrum, right? You could see this is the acetabular labrum, so attached to the acetabular lip. And this is, you could see, this is the lunate surface, and here below acetabular notch is bridged by the transverse acetabular ligament, and this transverse acetabular ligament is the continuation of the acetabular labrum at this notch, acetabular notch. A central non-articular part of the acetabulum is occupied by a pad of fat called the Haversian pad, right? This is a Haversian pad in the center, not shown in this picture. I have a picture of that image. I will show you very soon. So articular surface continued due to the height of the rim and the labrum. More than half of the femoral head fits within acetabulum, right? More than half. In the center, a deep non-articular part is seen called the acetabular fossa, which is contributed mainly by the ischium, right? Acetabular fossa in the center. So let's see where this acetabular fossa. Here you could see acetabular fossa. Here you could see, right? I will enlarge and zoom for you. This is acetabular fossa. Here you could see, right? So now I will talk, and rather I will like and love to talk about stability. It's an amazing feature of the hip joint, the stability as well as the mobility, both together. And this is only specific to this, our hip joint. Articular surfaces of the acetabulum and head of the femur are most congruent when hip joint is flexed 90 degree, rotated laterally 10 degree, and abducted 5 degree, right? This is the congruence. Generally, in all joints, stability and range of movements are inversely proportional to each other. The hip joint is an extraordinary example of a higher degree of both stability and movement. So I told you already. And what are the factors responsible for stability? Its complete ball and socket construction, that is depth of the socket, the acetabulum, and the strength of its joint capsule compared to weak capsule of shoulder joint, right? So this capsule I will talk about in length very soon. And the third factor is attachment of the muscles and the ligaments that cross the joint, right? So muscles and ligaments, very strong factors in contributing to the stability of the joint. And some of the people say also the atmospheric pressure contributing to stability. And this is the stability versus mobility continues, and its great range of mobility results from the femur having a long neck that is much narrower than the head. This is, you can see, femur has a long neck, and this neck is narrower than the head, right? The tight fit of femoral head into the acetabulum that is deepened by the labrum constitute the hip of very stable joint, which is further reinforced by ligaments on the outside of the capsule, especially iliofemoral ligament. I will tell you, iliofemoral ligament, the ligament of Bigelow, is the strongest ligament of the body. Short muscles of the gluteal region are chief muscular stabilizers, especially the gluteus medius and the gluteus minimus. Right? So most stable and least stable position of joint. Most stable position of joint is that of extension with some medial rotation and abduction, right? And the joint is least stable position when flexed and adducted. Dislocation needs considerable force, but it can occur and does occur. For example, in a serious car accident, head of the femur is typically displaced posteriorly, and there is often an accompanying fracture at the back of the acetabulum. So, joint capsule of the hip joint. Strong joint capsule enclose the hip joint, composed of a loose external layer, which is the fibrous capsule, and an internal synovial membrane, right? So let's see, zooming in. So you could see this, right? This is fibrous layer of the joint capsule, fibrous layer. And inside is, you could see this second is a synovial membrane, right? Here you could see I've labeled for you this synovial membrane, right? You could see synovial membrane. So outer is a fibrous layer of the joint capsule, and inside is a synovial membrane, like it is present in every joint, synovial joint. And yes, now you about joint capsule of hip joint attachments, proximal and distal. And the proximal attachment is fibrous layer is attached to the acetabulum, just peripheral to acetabular rim, to which the labrum is attached, and through the transverse acetabular ligament. So let's zoom in to see this description. So you could see this fibrous layer attached here to the labrum here, and yes, and here, and this is the, you could see the here transverse acetabular ligament here it's attaching fibrous layer attaching both to both of this transverse acetabular ligament. This is proximal attachment. And distal attachment is very interesting. Fibrous layer attaches to the femoral neck only anteriorly. Of course, this capsule distally wraps around the femoral neck and is attaches to the femoral neck only anteriorly at the intertrochanteric line and root of the greater trochanter. Here you could see, I will show you in very soon. Let's see anteriorly. Here you could see, this is the anterior view of the femur. And this is, from here, this is the capsule wraps around the neck. And this is the intertrochanteric line. You could see this in the blue. And the capsule attaches here. And this is the greater trochanter and also to this part of the greater trochanter. This is the anterior attachment of the capsule of the hip joint. And what happens posteriorly? Let's see. Fibrous layer also wraps around it posteriorly. It crosses the femoral neck, of course, but it does not reach the intertrochanteric crest, and just it remains proximal to that, and also it is not attached to it, right? I can zoom in and tell you as well from here. Let's see. You could see this is the posterior view, and this is the neck, and this is the intertrochanteric crest, and it doesn't reach here and attaches to it, right? So it reaches here, this the fibrous capsule, right? This is a reach out of the fibrous capsule here. So capsule is loose but immensely strong. This is good. In shoulder joint, it has to be comparison in the domain of the stability, but the capsule in shoulder joint is also loose, but it is weak there. Here the capsule is also loose, but it is immensely strong. Most of the fibers of the fibrous layers of the capsule take a spiral course, and from hip bone towards the intertrochanteric line of the femur, but a few deep fibers pass circularly around neck, constituting the orbicular zone. You could see this is the orbicular zone. So again, I zoom in for you, right? No option left for me to zooming in again and again for the clarity purpose. I want everything to be crystal clear in whatever I discuss with you in my channel Learning Anatomy. Like I discuss in joints, knee joint with you. So class C video, knee joint as well. Orbicular zone. You could see this is the orbicular zone, right? This is the orbicular zone, right? Circular fibers. So this is a very interesting picture, and let's discuss that. So this is a thick part of the fibrous layer form ligaments of the hip joint, which take a spiral course from the pelvis to femur. When hip joint is extended, right, the spiraling ligaments and fibers wind more tightly, thus constricting the capsule and drawing femoral head tightly into the acetabulum, right? This is the thing. This is the winding of the these ligaments and in extension, and it draws connected structures together, right? Here you could see this is the one position, and here you could see this is the winding, and here is the fibers are really, you could see, taut. And tightened fibrous layer increases stability of the hip joint, but it limits extension of the joint to 10 to 20 degrees beyond the vertical position, right? When flexion is performed, increasing unwinding of the spiraling ligaments and fibers take place. This allows considerable flexion of the hip joint with increasing mobility. Here you could see, right? This is the winding, right? You could see, and obviously here you could see this would be the unwinding. So let's move on. So this is the fibrous capsule is strengthened by 3 intrinsic ligaments, which take origin from each constituent bone of the hip bone, which is 3 bone parts of the hip bone: ischium, the ilium, and the pubis. So the iliofemoral ligament of Bigelow, pubofemoral ligament, and the ischiofemoral ligament. So let's discuss these one by one. The iliofemoral ligament of Bigelow. This is the first one, reinforces and strengthens the hip joint. A very, very strong ligament. And this is the strongest ligament of the body's strongest ligament. So anteriorly and posteriorly it passes is a strong Y-shaped ligament, which is attached proximally to the anterior spherical spine and acetabular rim, and distally to the intertrochanteric line. Let's see that. Here you could see this. This is the iliofemoral ligament, right? So let's enlarge. So more clarity, and don't want to be any ambiguity about that. This is a iliofemoral ligament. It's 2 parts of that. You could see this is the limb of the Y attached to the lower part of the anterior inferior iliac spine, and also to the acetabulum, some part. And here you could see this, and then this descending down, and passing superiorly and interiorly. And this is the intertrochanteric line attaching to the intertrochanteric line distally. Here you could see as well the distal attachment. This is the iliofemoral ligament attachment here, right? This is the iliofemoral ligament in blue. Here as well, you could see iliofemoral ligament attachment site on the intertrochanteric line, right? You could see this, right? This is the proximal attachment of the ligament on the above the sternum, and this is the distal attachment to the intertrochanteric line. So the iliofemoral ligament limits hyperextension of hip joint during standing by skewing the femoral head into sternum via the mechanism discussed before, right? I discussed very effectively, I believe that in detail. So pubofemoral ligament, right? This is next in strength to the iliofemoral ligament, and it passes anteriorly and inferiorly, and it takes origin from the obturator crest of the pubic bone, right? You could see this is the pubic bone, and it takes it from origin from its crest, obturator crest, passes laterally and inferiorly to blend with the fibrous layer of the joint capsule. Here you could see this passes laterally and inferiorly, and this ligament blends with medial part of the iliofemoral ligament and tightens during movements of the extension and abduction of the hip joint. So it prevents the over abduction. You could see this here. This is the blending. Here you could see this. Let's also zoom in for a while, for a few seconds. Here you could see this. Yes, this is a pubofemoral ligament. You could see this, and it is blending with the medial part of this iliofemoral ligament. So this is the last ischiofemoral ligament, which is the weakest of the three ligaments, and it lies posteriorly, of course. Takes origin from the ischial part of the acetabular rim. You could see this. This is the ischiofemoral ligament. This is the ischial part of the acetabular rim. You could see this. This is the rim. It's spiral supralaterally, right, to femoral neck, being a normal, being medial to the base of the greater trochanter. This is a greater trochanter, and it is medial to that. So the ligaments and the periarticular muscles, medial and lateral rotators of the thigh, play an essential role in maintaining the structural integrity of the hip joint. Both muscles and the ligaments pull femoral head medially into the acetabulum, and in doing so, they are reciprocally balanced. This is very important. What is this reciprocally balanced? The medial flexors are located anteriorly, are fewer and weaker and less advantaged mechanically, while the anterior ligaments are the strongest. On the other hand, ligaments that lie posteriorly are weaker, right? So medial rotators are stronger, abundant, and more advantaged mechanically, right? This is the thing. This is, I told you, this is the reciprocal balance of this muscles and the ligaments, right? Where the muscles are strong and the ligaments are weak, and when the ligaments are strong, the muscles are weak, and vice versa. So let's talk about synovial membrane. The synovial membrane lines the internal surface of the fibrous layer in all synovial joints, and it lines also any intracapsular bony surfaces not lined with the articular cartilage. So in hip joint, where the fibrous layer is attached to the femur distant from the articular cartilage covering the femoral head, the synovial membrane of the hip joint reflects proximally along femoral neck to the edge of the femoral head. I've shown you already this synovial membrane. Let's see again the synovial membrane. Here you could see this is the synovial membrane, right? This is the femoral head. Here you could see this is synovial membrane, right? Going all along the capsule, fibrous part. This is that picture enlarged already. I've shown you in zoom form. Longitudinal synovial folds are retinacula. So important word, retinacula occur in synovial membrane that cover the femoral neck. They cover the femoral neck, the retinacula. So we'll discuss in detail. Subsynovial retinacular arteries, which are branches of the medial and a few of the lateral circumflex femoral artery that supply the femoral head and neck, course within synovial folds. Right? You could see this. This is the retinacular arteries, and they are in the synovial retinacular folds. Here is the, synovial retinacular folds, and these are the retinacular arteries. They can be sometimes branches of the medial or lateral circumflex femoral artery. And here you go. Next, on to the ligaments of the head of the femur, essentially a synovial fold that constitute a blood vessel, is weak and less important in giving strength to hip joint. This is the ligamentum teres. You could see this. This is not contributing as much to the strength, right? So ligamentum teres, and the wide end of the ligament is attached to the margins of the stapler notch. Here you could see wide end, and this is attached to the margins of the notch, and the narrow end is attached to the fovea of the ligament of the head. Here you could see this. So let me now zoom into that. Here you could see this. Yes, this is the wide end of the ligamentum teres attached to the acetabular ligament in the acetabular notch, you can say. And this is the narrow end, and this is attached to the fovea. And there is an artery within that. It's right, artery of the head of the femur. And a fat pad, Haversian pad in acetabular fossa fills the part of the acetabular fossa that is occupied with the ligament of the femoral head. I'll show you this picture. Synovial membrane covers both the ligament and the fat pad. So role of fat pad, the pliable nature of fat pad allows it to change shape to accommodate variations in congruity of femoral head and acetabulum. In addition to adapt to changes in position of the ligament of head during the joint movements, right? So you could see this eversion fat of pad. Here you could see, here this is fat pad or the eversion pad in acetabular fossa covered by synovial membrane, right? Here it is. I discussed the role. A bursa for the obturator externus and a bursa for the psoas also present in these. So very important now, this relations. So interior, posterior, superior, and inferior, that we can already know some idea, and it can discuss very smoothly from this picture, right? You could see this. This is the joint, right? And its position, and this is the superior position, this is the inferior position, this is anterior, and this is posterior. So first of all, let's discuss what is the anterior relations of the hip joint. First of all, you could see there is the rectus femoris muscle anteriorly, rectus femoris. Then is the iliopsoas, this iliopsoas anteriorly lying. And third one is this pectineus. This is the pectineus, right? And this, this pectineus and this, iliopsoas, they separate this important femoral vessel, femoral artery and vein from this joint, right? This is the thing. So this is the anterior relation, and let's move on to the posterior relations. So these are, you could see over here, this gemellus superior and gemellus inferior, and this obturator internus, these three muscles, right? And then is the quadratus femoris, right? So all these muscles, these three, the obturator and the obturator internus, externus, and the gemelli. So the gemellus superior and inferior and obturator internus only, these three muscles. But gemellus superior, inferior, and obturator internus, and this, your quadratus femoris, they all separate sciatic nerve from the joint. Very important. So then superiorly and inferiorly, what happens over here? What are the relations? I mean, here you could see inferiorly is the, your this obturator externus, right? And superiorly is the main muscle is the gluteus minimus, right? This is the thing. And then is the piriformis, right? This is the piriformis, and this is the gluteus minimus, these two muscles lying superiorly, right? Superiorly is the gluteus minimus and piriformis, and inferiorly the obturator externus tendon. So very important movements of the hip joint: flexion, extension, abduction, adduction, medial rotation, and lateral rotation, circumduction. The trunk movements at the hip joints are also very important, such as those taking place when a person lifts their trunk from supine position during sit-ups or keeps pelvis level when one foot is off the ground. So let's discuss flexion and extension. So the degree of extension and flexion possible at hip joint is dependent on the position of the knee. When the knee is flexed, it relaxing hamstrings. Hip joint can be actively flexed until the thigh almost reaches anterior abdominal wall and can reach it via more passive flexion. Not all of this movement takes place at the hip joint. Some is a result of flexion of vertebral column. As the hip joint is being extended, the fibrous layer of the hip joint capsule, particularly the iliofemoral ligament, gets taut. That is why the hip can mostly be extended only to some extent beyond the vertical, except by movement of bony pelvis, that is flexion of lumbar vertebrae. Then the adduction and abduction. From the anatomical position, range of abduction is mostly a bit greater than adduction. About 60 degree of abduction at the hip joint can occur in the extended tight thigh position, and more when it is flexed. And the lateral rotation is much more stronger than the medial rotation. So muscles producing movements, they are listed over here, right? So you could see this is the discussion, now let's discuss these muscles. And iliopsoas, this is the strongest flexor of the hip. Besides action as an adductor, the adductor magnus also brings about flexion, anterior or aponeurotic part, and extension. There's a posterior or hamstring part. Many muscles take part in both flexion and adduction, pectineus and gracilis, as well as three adductor muscles. So role of glutea in movements, very important. Also, these glutea will play a role in Trendelenburg sign, when the one foot is off the ground and they balance that pelvis opposite side. In addition to acting as abductors, anterior portion of the gluteus medius and minimus produce medial rotation. Gluteus maximus acts as primary extensor from flex to straight standing position, and beyond this point posteriorly extension is provided primarily by hamstrings. Gluteus maximus also act as a lateral rotator. So this is the, let's now discuss movements from this table. This is a summary. Abductors are glutei minimus and medius, and adductors are adductor magnus, longus, and brevis. Extensors, I told you already, gluteus maximus, semitendinosus, and semimembranosus, the hamstrings. And the flexors are iliopsoas, rectus femoris, tensofacial latae, and the pectineus and the sartorius. Internal rotation, the gluteus medius, minimus, tensor fasciae latae, and external rotation, iliopsoas, gluteus maximus, piriformis, and obturator. This I discussed with you already. And so now very important, the blood supply. Arteries that supply the hip joint are the following. It's easy to discuss it from the picture, the arteries supplying the hip joint. You could see the branches of the obturator artery, right? And branches of the profunda femoris artery supply that. Profunda femoris artery, let's discuss that first. Gives the lateral circumfemoral circumflex lateral circumflex femoral artery here, and the medial circumflex femoral artery here, right? So its branches go there up, and the obturator artery gives the acetabular branch artery to the head of the femur in ligament that I discussed. You already shown you, and here you could see again this, right? So this, when this is ruptured, this artery in some accidents of the this portion, so this leads to the avascular necrosis of the head of the femur. We'll discuss it in clinical in the second video. So here you could see this, and this is the medial circumflex femoral artery giving branches, and it is more important in supplying this hip joint than the lateral one. Why? Because it passes its branches more easily to this joint, and passage to this joint through the neck is relatively easy for them. Whereas for the lateral circumflex femoral artery, it is relatively difficult because it has to pierce the iliofemoral ligament. So branches which reach inside are tiny and few. The chief, I told you already that retinacular arteries are these branches. This I discussed with you. According to Hilton's law, the nerves supplying the muscles that extend directly across and act as a particular joint also innervate that very joint. This is the Hilton's law. So articular rami take origin from intramuscular rami of the muscular branches and also directly from the named nerves. Knowledge of nerve supply of muscles and their relationship to the joints make us to deduce nerve supply of most of the joints. Possible deductions as regards a hip joint and its muscular relationships are discussed on next slide. Flexors are innervated with femoral nerve. They pass anterior to the hip joint. The anterior aspect of the hip joint gets its nerve supply from the femoral nerve directly and or through articular rami of muscular branches to pectineus and rectus femoris. Lateral rotators pass posterior-inferior to the joint. The inferior aspect of the joint gets its nerve supply from the obturator nerve directly and through articular rami of the muscular branch to obturator externus, and the posterior aspect gets its nerve supply from the nerve to quadratus femoris. Abductors are innervated by the superior gluteal nerve and pass superior to the hip joint. So the superior aspect of the hip joint is supplied by the superior gluteal nerve. So that is why I discussed the muscles with you and the relations of the hip joint in detail with the picture, so you could see these nerve supplies, how the facilitated to the various parts of the hip joint. So I thank you very much for watching my video. Please stay tuned. The next video, the clinicals of the this hip joint, and subscribe my channel and support it by sharing. Goodbye.